It's good to see you all today. I'm going to recognize myself for 5 minutes. I'm from the great state of Oklahoma, in which we have over 800,000 Medicare beneficiaries, so I know how important it is to protect Medicare for our senior population. There is no question that Medicare waste, fraud, and abuse steals critical resources away from our most vulnerable and drive up costs for all, patients, providers, and taxpayers. Fraudulent activity is surging among home health and hospice providers, including billing for services never rendered and schemes to bill taxpayer for ghost patients. These deceptive practices hurt honest providers and harm patients. I frequently hear from providers and patients back home about how fraud drives up premiums and out-of-pocket costs and diverts taxpayer dollars away from real care for our seniors. At the same time, honest providers face growing administrative red tape and regulatory burdens. In partnership with my colleague from Alabama, Congresswoman Sewell, we introduced the Home Health Stabilization Act to create a more sustainable payment system for Medicare home health agencies, ensuring patients have access to rehabilitative care in their homes. That said, it is difficult to enact meaningful payment reforms when fraudulent agencies skew data and stain the industry as a whole. Ms. Clark, I know you have seen similar situation play out in the hospice space. Can you walk us through the financial effects legitimate providers face when their industry is ripe with fraud?
Absolutely. When you have a beneficiary that is enrolled into a hospice fraudulently, like Dr. Lynn, what happens is there is a cap, an overall hospice cap in the lifetime under Medicare that they will pay a provider, right? And she has had that spend applied to her account, her MIB number, okay? And what we're seeing, what's happening in California is because of all these synthetic patients that were enrolled in hospice, they didn't need it, they didn't know it. And then when you have a patient like my members back here that needed hospice, they walk in, this gentleman is in pain, he needs care, only to find out he's already been on hospice. And this was in October of 25. They enrolled him in July of 25. They bill for those services. That amount of money is gone. It is capped out. Now, my members that are sitting behind me, they picked up this patient that needed care, and they will, when we call the cap report, when they true up that cap at the in every February, I believe, they'll have to pay that money back that they were given to treat this patient, to treat this Medicare beneficiary. And this is happening time and time again in California because of all these fraudulent elections. So that is what will happen to a good provider. They will be on the hook.
So Oklahoma is taking some strong action at the state level. Just this last month, Oklahoma's Medicaid Fraud Control Unit concluded Operation Sooner Shield. Operation Sooner Shield spanned 10 counties, resulting in dozens of arrests and more than $1.5 million in recovered in restitution and fines. If that much fraud and abuse was found in one short operation, I can only imagine how much more is still to uncover. This operation shows that what a real partnership between a state and local law enforcement can achieve. Medicare fraud often crosses federal and state lines, and bad actors try to exploit gaps in coordination. In fact, last week at our hearing, Secretary Kennedy discussed the work that HHS and CMS are doing to catch the fraudsters who have stolen hundreds of millions of dollars of taxpayer dollars. Ms. Clark, continue with you with the remaining time I have. How can Congress better support partnerships between agencies, state AGs, and local law enforcement to root out fraud more effectively and more adequately dismantle the networks rather than simply prosecuting individual fraudulent agents? Additionally, what tools or authorities would help scale up efforts like Operation Sooner Shield nationwide?
That's a great question. So if we work collaboratively together at the state level and the federal level, there's a plethora of data that is seen and developed. We have a task force in California. It was mandated by the California Auditor's Report. They said, you will sit down at a table and discuss all this. the OIG, the AG, DHCS, CDPH. And if we can do that at the federal level and share that information and be able to take out these fraudsters quickly and, you know, execute what is happening at a state level, and I know at the federal level that they're doing their thing. They're investigating these sham operations. And if we're sharing that information, then we will get these guys much quicker.
Thank you again. I appreciate your responses. And now I recognize the gentlelady from New York, Ms. Mallory-Takis.